Hi, Ralph.
Hi, Jim. How are you doing today?
I'm doing well, and hey, want to welcome our listeners to the Psychology Takeaway podcast. And today we have a special guest, right, Ralph?
We do. We have a delightful woman who works in mental health services, and she's going to be telling us what we lack as a small Michigan town. Elizabeth, why don't you introduce yourself and tell the listeners where your primary job is and what your other services are.
Well, thank you so much for inviting me to join you today. I'm Elizabeth Husbands. I'm a limited licensed psychologist. I've been doing this work for about 25 years now. I currently work in two places. I work with Rise Advocacy as their program manager. Rise provides domestic violence and sexual assault services to victims and survivors of both of those here in Mount Pleasant. And then I work with Central Michigan Care, which is an autism center. I do assessments for them for families who are looking to find answers for their children. I also have a private practice and I provide counseling, assessments for families and children. So I keep myself pretty busy.
Bet you do. What's your assessment, do you think, Elizabeth, of the incidence of emotional disturbance or mental illness, either here in Michigan or globally? Do you have a kind of a handle on that?
Well, I think that we're seeing a significant increase.
Okay.
I don't know, and especially since this pandemic. And I don't know if that's because we are just being more observant of what's happening in the world around us because we have kind of had to pay attention to each other, or if it's because of the pandemic itself and people are just talking about it more. But I definitely know that we've seen an increase in the need for services.
Yeah, I was listening to, I guess it was a program on NPR this week, and the announcers were saying that in Australia, youth suicide has gone up by threefold. And, that's a problem here in America, and I would assume it had been a problem in Australia before. So a threefold increase is probably going to be attributed to at least some of the pandemic, not necessarily the whole thing.
Yeah, and Australia was pretty draconian in its lockdowns, kind of like New York City. And I think a lot of people maybe felt very isolated. The Australians I've known have always been pretty outgoing folks, so missing contact with others, I think would have been a significant thing for Australian teens.
Not having a Foster's or a shrimp to put in the barbie?
Indeed.
Okay. Yeah. So it's kind of interesting. We focus on Australia, but or the United States, but as I read it, mental illness is a equal opportunity disability, and it is everywhere. And I can think perhaps even more so in countries where we have a lot of civil unrest, like Sudan, for example. I don't think we have any stats on what's going on there, but I'd be pretty amazed if we didn't have very significant adverse childhood experiences leading to later trauma.
Yeah, and one figure that has come up, Jim, that you cited was 25% of adults worldwide. Now that 25%, yeah, okay, so a quarter. Well, when you work it out worldwide, that's 3 billion people.
That's a few people, isn't it?
It is, yeah. That's basically India and China combined. If you took their two populations and spread them around the world, that would be the number of people who are suffering a mental illness.
Yeah. How do you like those numbers, Elizabeth?
That's staggering when you think about it in that way. I was just thinking, like, when you hear, 25%, that's not a lot. But when, Ralph transposes it into 3 billion, and then you think, well, India and China, we always think those are such highly populated places. But when you think about it, that those many people struggling with mental illness and not receiving the services that they need.
Mm-hmm.
And then I think about the number of people in our community.
Yeah. Well, you're working 3 jobs, it sounds like, with the care facility for autistic children, RISE with its programs for abused or I guess abused spouses, and then another one. We must have lots of services here in the middle part of Michigan, right?
No, we don't.
My tongue was firmly in my cheek at that
Yes,
point. Okay, yeah.
we are so, there is definitely a desert of services here.
Yeah. It's kind of like, I've heard somebody say, you draw a line from east to west through maybe St. John's or Lansing, and down below that line, more services. Above the line, as you say, kind of a desert.
Yeah, we have some services, and if we could even draw a circle around Mount Pleasant and say we have services for certain things, and then the further out you go, for our more rural communities, we just lack services overall. For certain things. Like, for example, if we look at people looking for substance abuse treatment, we just don't have that available here.
Okay.
We hit certain things, like if you want to go to an AA meeting, we can provide all the AA meetings you want. But if you're looking for more formal treatment, we just don't have those things available.
Yeah. Okay.
Yeah. And again, to look at it globally, so I gave the example of the population of India and China being globally the number of people with a mental health issue. And then you say, okay, well, 2/3 of people with mental health issues don't get adequate treatment. Let me see, 2/3 of 3 billion, that would be 2 billion people globally.
Yeah.
And I mean, that's a staggering figure.
Yeah. And there are a lot of reasons for it. One reason is the stigma that is still attached to mental illness. And so some people are going to self-select. They're just going to not seek mental health treatment. But one of the stats that I saw is that about 57% of people who need mental health treatment don't do it for a number of reasons. And one of the reasons is the stigma, perhaps. But another reason is a lack of resources. Another reason is the inability to pay for the services, right? Okay.
Yeah, so Elizabeth was telling us earlier that, well, you could tell it, Elizabeth, the problem of people who are on Medicaid.
If you have a state-funded insurance, there is such a limit to the number of places that you can go. Sure, if you have private insurance, you may have more resources available to you. But if you have a state-funded insurance and you happen to live in Mount Pleasant or any of the surrounding areas, the closest facility is Midland for any kind of a detox or rehab.
Okay.
And it's not the best quality of services.
Okay.
And there's probably a waiting list.
Yeah, I know at the clinic that I work in, there are some clients that have Medicaid, I think it is, and children, but yeah, I think you're right, it's probably pretty limited. And with some of these insurance accounts or policies, there's a fairly hefty copay too, which, $35, $40 might not seem like much, but for some people who are living in the ragged edge of nothing, it's significant. It's a matter of, do you go and see your therapist, or do you feed your kid?
Yeah. And for a lot of them, that is a big deterrent. And because if you think about having to do that every week,
Mm-hmm.
then we're talking, a significant amount of money in a month.
Right.
And for a lot of them, that's a third of their rent.
Mm-hmm.
And when we're putting it into very realistic numbers,
Yeah.
then they're making a huge decision. Do I take care of myself? Which for a lot of families, for a parent, that's being selfish, because now I'm taking a third of the rent, or I'm taking a grocery bill to take care of myself when I could be taking care of my family.
Mm-hmm.
And so then, I can't do that as a mom, or I can't do that as a father.
Right. Okay. I get you. Even something like the ability to get into a place that offers services. You've got to have a car that works. Here in Michigan, you have to be confident of driving in the wintertime. In fact, driving sometimes in pretty adverse weather. So there are, some physical things that are impediments too.
Well, and if you live in rural Michigan and you don't have a car, like if you live in Clare and you don't have a car, getting to a facility that provides services is going to be a challenge.
Yeah.
First, you have to find a place that is a provider for your insurance, because even a lot of the private practice places are opting not to accept many of the Medicaids because of the challenge of getting accepted, getting approved, all of the things that requires. So they're opting not to. So there you cut down the number of opportunities for someone to receive services. And then now getting there, we don't have the most reliable transit system. And if you're coming from Clare for an appointment, it could take you all day, because you've got to transfer here, you've got to meet this bus and transfer to this one. And so a 1 hour appointment could take you 8 hours.
Yeah, and that's coming from a town 15 miles away from Mount Pleasant.
Well, and then we're asking them to give up a day's work, really, for a lot of families.
Yeah.
Yeah. And, another thing that strikes me is that a lot of people who know they need the services, know they can't afford them, or they can't afford the time off work, end up basically self-medicating. So you say, well, yeah, I'm a little stressed right now, but a bottle of wine will take care of that tonight. And then a year later, you're saying, I think I might have an alcohol misuse problem. And then you say, well, wait a minute, that takes me back to my depression problem of a year ago, which I couldn't get treated. And now I've got depression and an alcohol use disorder.
Comorbidity there.
Yeah.
Okay.
So, it's a double whammy for a lot of people.
Yeah, it is.
Well, and I was just thinking, I can hear the skeptics saying, well, why aren't they going for telehealth? And we've got that available in this day and age. Well, again, if you're living in a rural community, you may have spotty Wi-Fi, or you may be in a community where you can't you may be able to pay for it and you can't get it. I'm thinking of a friend of mine who is capable of paying for it. We're on a board together. And oftentimes when we meet via Zoom, she's got to turn her video off because her satellite Wi-Fi system can't do audio and video. And so this is somebody who is well able to afford it, but because of where she lives, she can't do both. Her bandwidth just doesn't provide for that. So now you take that to a person who is struggling to make ends meet, and they may not have the capability of doing a telehealth service. Or they may be doing a telephone, but then if they don't have the minutes to do an hour-long session, or, so we're again coming to that place where we're asking people to make choices.
Yeah.
Am I taking care of myself? Am I taking care of my family? If my phone plan only allows me to have 30 minutes a month, then I'm going to use those very sparingly. I'm going to text you all you want, because text doesn't use my minutes. But then to do an actual session where I'm going to have to do 30 minutes or 60 minutes, then that's going to be something else.
Yeah, I mean that's a good point because telehealth is not something that a lot of people are comfortable with. I've seen clients on the screen, and literally all hell is breaking loose in the home, and the privacy that we would like to see as therapists is pretty much out the window. So there's that part of it. I've seen several clients who had unstable connection or connectability, and a call that gets dropped every 2 or 3 minutes doesn't work very well. But this has made me think of something else, and we have that number. Ralph, what's 25% of the world population about?
25% or 3 billion.
3 billion people. Okay, well, here in the United States we have 350 million people. So, a lot less than even 1 billion. And so there are two things that come to mind. One, if you're in Sudan, or if you're in Kazakhstan, or if you're in China, do you have people who are trained as mental health professionals to treat you, even if you had access to them? And are there enough of them? What do you think, Elizabeth?
I think in some of those places you probably do, because we have a lot of organizations that will send people there.
Okay.
But depending on how, again, I think about, like, if you're in one of those more central places, yes, you may have access, but it's limited because those people are on, short-term loan kind of things.
Yeah, Doctors Without Borders, Therapists Without Borders. I haven't heard that one yet.
Well, and then you have, then you have trauma upon trauma upon trauma. So
Yes.
you're only
Yeah.
going to be scratching the surface of
Yeah.
anything.
Yeah.
And as we know, when you're doing trauma work, it's a long process. You may do 6 months and you hit, okay, I need a break. Our clients are going to scatter for a while, and then they're going to change therapists because you just stirred up a hornet's nest that I don't want to deal with, and then they're going to come back. But when you're in a country that has been through the kind of trauma that the countries you mentioned have been through, you need somebody who has really been well trained. And I, for one, am not going to be going to those countries. And most of our well-trained clinicians are not.
Right.
And so they're not getting the help that they need.
Yeah,
Yeah.
I've been with the psychology training program here at Central Michigan University for 50 years, and very seldom do we have a student from even a European country, let alone a developing country. And one of the things that a lot of people have talked about, and Ralph and I have talked about it with Aruk, and that is work with the black and brown community. Very seldom have we had therapists in training in our program that represent that community. I mean, I can think of half a dozen perhaps, but in 50 years that's not very many. And so that's a group of people that are underrepresented in terms of who they'd go and see. Because if I were a black or a brown person, I'd probably want to see a black or a brown therapist.
I would say most of my private practice are people of color seeking therapists who look like themselves.
Yeah, and that makes a lot of sense.
And I have a good portion of my practice that are therapists.
Okay.
Yeah.
Well, that's another good point. Who's a therapist for the therapist? Well, there is a therapist out there. One of the stats that is alarming right now is that the suicide rate among doctors has doubled, in the last few years. Again, COVID related or something else related. We don't know. But the idea of the therapist taking care of himself or herself is just about as foreign as the idea of, well, I'm going to give up some gas money or food money, to go into therapy.
Yeah. Now, the other thing when we were talking about people who have to travel to get to a therapist and the difficulty of that is that 38% of Americans have had to wait longer than a week to get access to a therapist. Yeah, that doesn't sound very critical, hey, I've got a sore shoulder. Well, you're going to have to wait a week to see your doctor. Hey, I've got a sore brain. You're going to have to wait a week to see your therapist. But if you think of it this way, I'm having a lot of thoughts of ending it all and going down to the woodshed with a case of beer and a rope and hanging myself. And, it's really starting to be kind of overwhelming. And
just wait a week and we'll get you in there, Ralph, okay?
Yeah, well, by the time a week has gone by, you may not get me in, except to the funeral director.
Another cure.
Yeah, permanent. But so, and Elizabeth was saying, we don't have anything very effective for detoxing or drug addiction locally in terms of programs. A young friend of mine had to travel 150 miles to get to a detox and treatment center, and he did not have a reliable car. So my wife and I were able to take him. But if you're in a position where you say, gee, I've got to go all the way to there and I don't have anybody who wants to take me, might as well be the moon.
Well, let's add another complication to that. Add a young parent with children. I had a client who is a young mother with 2 children. One was 6, one was a year and a half, looking for treatment. There was one treatment center that we found that would accept a family. And that was in the UP.
Okay.
And she didn't have a vehicle.
Okay. What about community mental health? What can they help out?
Community mental health provides a screening service, but community mental health is so overworked right now.
Oh, okay.
And they are having the same issue that 90% of employers are having right now. They have open positions and nobody to fill them.
Okay.
And so their employees are overworked. They have employees that are doing multiple jobs. And so sometimes there is a delay in finding the services that you need because you may have somebody, they have a program set up for people to be screened, but there may be people sitting at the hospital for 2 or 3 hours waiting for somebody to come in and screen them.
Okay. And does community mental health supply support services for, like the young mother that you talked about? Can she get a babysitter so that she can come into a therapy session if she can find a therapist?
Actually, they do.
Okay.
Their case manager will help with that. And I only, again, know that the answer to that because I had a client who works with community mental health is trying to schedule for an assessment from one of her kids. And that's been a hindrance. And her case manager is working to help set up a babysitter so that she can have someone sit with the younger child so we can get the autism set up. It takes a while, but it's a service that they can provide.
Okay. My daughter works for community mental health, and she is, I believe, if her job hasn't changed recently, she's called a wraparound facilitator. And it seems like what she does, and she's been on the podcast before, and we'll probably bring her back to talk about this. Seems like she kind of coordinates as best that she can the various services that are in the community. So there's not one size fits all place for a person with a problem, but you might need a babysitter. I don't know if she can provide reliable transportation or not. I don't know, So we'll get Bridget on, okay?
Yeah, that
Have her
would be
talk
good.
about this.
We, one of the things that is also true, and we've been talking about the difference between rural and urban, is folks who are living in rural communities may not know what's available and may in fact not have any easy way of finding out. For example, I'm sitting at a table where there are two therapists, and if I needed some treatment, I could say, Jim, who do you recommend? What do you recommend? Or Elizabeth, what do you recommend? And maybe a rural person doesn't know anybody they can talk to and say, where can I go?
So a great resource for just people in general is to dial 211. You can call 211 and ask them a multitude of questions, like I need some help paying my utility bills. Who can I contact? I need some help. My car is on the fritz and I need my car to get to work. Is there someone in our community that will help with that? 211 can help you figure out who the resources may be for that. I need mental health services, but I can't afford my copays. Are there people who help with that? 211 is a great resource for a multitude of those things.
So this is sort of like 911, but it's for general problem solving that.
Yeah, and they are available 24 hours a day. I see that Jim brought in the community resource directory, and you can actually look that up online. It's available at www.apecap.org.
Now this is for the 4 counties around here. Isabella, Clare, Montcalm,
In Gratiot.
and Gratiot.
Yeah.
Okay. Do you think that, because this is a fairly big document, it must be 15, 20 pages in length. Do you think that other CAPs or other
Yep.
groups have these things?
The HARA for whatever county you're in usually puts one of those out.
The what?
The HARA, the Local Housing Resource Agency.
Housing Resource Agency.
Yeah,
That's a new word for me. Okay.
Yeah.
Yeah, and they're typically the organization that provides housing assistance. And so ACAP is our local HARA for Isabella County and those counties around. But they are the ones that will typically put that resource out. But 211 can also help you, like link you to those various resources. I refer tons of clients to both of those resources.
Okay. Yeah, I'm looking at, we have a page here, quick find phone numbers, and I see one with your organization, Rise Advocacy, is here, and Life Choices, Christian Counseling. So, at least there's a place to start, right? Okay.
Yeah, and so those two resources are easy to find, and they typically can help you find a ton of other resources for things. The Salvation Army is another really good one to have access to. They can lead you to a lot of other things, and especially right now with Christmas coming up, Salvation Army is taking enrollment for their Christmas program. So if you're struggling to make ends meet and you're wondering how you're going to do it for your kids, contact the Salvation Army in your community and look into that.
Yeah. I'm looking at some of the hotline phone numbers. We've talked in the past about the National Suicide Prevention Hotline, but there are hotlines for National Runaway Safety Hotline.
RISE has a 24-hour crisis line. There's somebody available 24 hours to respond to both sexual assault and domestic violence.
Okay, in Mount Pleasant we have Listening Ear, which is a crisis
Yeah,
hotline too. Are you connected with that group?
yeah, that 411 will connect you to any of those resources. That's why I usually say 411, because it's an easy number for people to remember, and they can connect you from that 411 number. They can connect you to RISE, they can connect you to Listening Ear, they can connect you to the National Suicide Hotline, they can connect you to any of those crisis lines that you may need.
Okay, so at 411, there's a person sitting there by the phone waiting to talk to you if you have a problem.
24 hours a day.
They must have several people that they rotate through, right?
They do.
Okay. Any idea what the utilization rate is? Are they busy? Or?
They are fairly
Okay.
busy.
Okay. So, well, Ralph, you have given us in your usual way some gloomy statistics, but thank you, Elizabeth, for leavening this a little bit. And yeah, we have some problems out there, obviously, and some problems in our field, psychology. But as Elizabeth points out, there are some things that are being done to try to help people in crisis.
Yeah, and one of the things, that I tend to be a little skeptic about, I'm from the government, I'm here to help you, but when the physical infrastructure bill that's currently going through the process passes, one of the things in that is 5G connectivity. And I think that will go a long way toward upping the game for rural people in terms of teletherapy, telehealth, that they will not have this spotty, iffy connection anymore. At least that's my hope.
Mm-hmm. Okay. Elizabeth, we're going to let you have the last word here. What do you want our listeners to take away?
That if you are struggling and you need help, please reach out. I know that there are tons of barriers, but one of the things that, as an advocate, I've learned over the years is that, there are people out there who are really, really wanting to help. And a phone call can connect you to many, many resources. And don't let lack of insurance or lack of your thought about resources prevent you from reaching out and getting the help that's available for you.
And for our listeners who are in other countries, hey, maybe you should think about putting together a community resource directory for your neighborhood, so that you can let other people know what is available. Because if you don't know what's available, guess what? You're not going to access it. Okay. Well, until next time, this is Jim.
And Ralph,
Saying,
keep your stick on the ice.
because we're all in this
Together.
together.